Hi class, this is Tek Acharya and I'm going to talk about alcoholism. As we can see in this picture that alcoholism affects our bodies in numerous ways. What alcoholism means to me, the continual drinking of alcohol or its products due to a phenomenon of continual trigger of its need by person's body, mind and spirit. The person basically become dependent on its consumption as his brain has been hijacked and eclipsed. A mental illness that a person progressively acquired, and even though he does not want to drink, but now it became a need. Mental effects of alcoholism. The alcoholic knows that he is not doing good by drinking alcohol but cannot stop as its withdrawal effect is so devastating that he don't have any other options left. They make ways to get it when needed, and in most cases they do it hidden. In doing so, they often end up being alone from the rest of the world. Being alone or staying hidden from friends and family members is a mentally painful act. Even in their highs, they know they were not supposed to drink, but that is the only way they can be back to their normal life. This phenomenon repeats over and over that a person becomes mentally ill. And if not treated on time, the person can die or suicide. Physical effect of alcoholism. There are many physical effects, but I'm going to talk few of those. The body becomes impaired or slowed motion. Lack of appetite. They would rather spend their money for alcohol than food. Shrunken eyes, muscles, faded skin. The person looks more younger initially and more older later than his actual age. Person's speech is slowed and have shaky voice and body. They overdoses. They become injured at work or in road. Moderate to low functioning kidney, lungs, liver, and brain leading to irreparable loss to them. They have poor vision. Social effect. The person becomes separated from their society. The person finds himself hesitant during social gatherings. Other people treat them as inhuman, evil, or socially neglected. People commit or potentially commit crimes. Economy dramatically decreases and end up with debt and no credit. Family leave them alone. Finds themselves either in street, in jail, or in rehab center, or with other lawsuits. End up in prostitution and other drug, jobless and hopeless. Effect in regards to level of alcohol in the blood. People fail to judgment and accuracy. Their vision is impaired. The reaction time is slowed. They can lack consciousness at any time. Too loud, too low, or impatient. They can pass out at any time and can never return. What happens to the brain? There are different types, different parts of brain which are designated for different purpose, such as hippocampus for memory control, hypothalamus for heart rate and hunger, thirst. Similarly, cortex, cerebellum, medulla oblongata, and central nervous system. If a person drinks more, too much at a time, then all of these will be impaired. They cannot work as normal, and eventually a person becomes totally collapsed. How alcohol attacks the brain? First of all, alcohol affects the forebrain and assaults motor coordination and decision making. Then alcohol knocks out the midbrain and you lose control over emotions and increases chances of blackout. Finally, alcohol batters the brainstem as it affects heart rate, body temperature, appetite, consciousness, a dangerous and a potentially fatal condition. How brain changes according to alcohol consumption. The pathways and connections necessary for learning may be permanently damaged. Thought processes are deorganized and memory and concentrations are dulled. Judgment is altered and coordination is impaired. Movement, speech, and visions may be affected. Alcohol use may increase risk of stroke in young people. Health effect in general. Um, there can be short-term, including hangovers, seki, blackouts, and in long-term effect, cirrhosis of liver, cancer of mouth and tongue, um, delirium tremor, which is the constant shaking, and depression. Withdrawal symptoms. There are many withdrawal symptoms that includes anxiety, agitation, irritability, nausea, vomiting, diarrhea, convulsions, insomnia, tremor of hand, tongues, eyelids, hallucinations, sweating, fever with or without infection, hypertension, and many more. Treatment plan. Treatment plan is categorized into three different ways, which is biological, psychological, and social. And they do this with four different steps. There are medications which, such as um, disulfiram, naltrexone, camperol, and many other non-FDA product approved medications, and they do a extensive treatment plan that includes the first step towards recovery, where they do extensive studies of how they become intoxicated and find ways to treat the person accordingly. The detoxification is a process of removing toxins from the body. After that, they will take the patients to rehab center where they will learn to live without alcohol. And in aftercare program, they will help repairing their family relation, build the credit, and many more. Alcoholism in India, compared to US, people buy, sell, and drink at any age, nearly anywhere. One don't make complaint about others unless it's a big issue. People with this disorder once were thought to have a character defect or a moral weakness. Some people mistakenly still believe that. There are a lot of issues such as vandalism, theft, murder, etc. There are few people treated for alcohol abuse, no Alcoholics Anonymous, no meetings at all, no good treatment facilities and rehab centers, and no expertise. Medications are rare. And thank you.